Welcome to HealthAfrik, where we delve into health-related issues in Africa, as well as exploring solutions to them. My name is Isabella Tata Henakwa. In our last episode, we delved into the realm of telemedicine and digital health solutions. Today, we continue the journey as we introduce a student who has developed an AI chatbot specifically designed to transform the healthcare experience for patients. Stay with us as we go for a quick break for an insightful conversation. We'll be right back. Welcome back from the break, and this is HealthAfrik, brought to you by the Association of African Universities. Today's episode focuses on revolutionizing African healthcare system through AI chatbots. And as I mentioned earlier, our guest for today is a student from Strathmore University, Miss Maria Ogamba. She is a Master of Science student studying data science and analytics. She's also the one behind WellBuddy chatbot and specifically designed to support mental health. She's going to help us discuss how AI is going to enhance African healthcare system. Hello, Miss Maria Ogamba. You're welcome to HealthAfrik.
Thank you very much.
And also thank you for answering our request when we reach out to you. Right, before we move to the topic for today, I would like you to briefly tell us more about yourself, who you are, and what you're doing.
Thank you. My name is Maria Ogamba. I'm from Kenya. I'm currently studying the Masters of Data Science and Analytics, and I also work as a business intelligence analyst at Strathmore University.
Great. You're welcome once again. Great. Now, before we move to today's main topic, that is artificial intelligence chatbot, I would like currently technology is transforming various aspects of our activities, including healthcare delivery. I would like you to highlight some of the role of artificial intelligence solutions driven to, trying to help us solve our health-related issues in Africa.
First off, I would like to say I think it is something that is very significant in addressing these issues. I think one main aspect that most of us are focusing on is enhancing healthcare delivery. So I believe it can be applied in various aspects in the healthcare industry by improving maybe accuracy of diagnosis, enabling remote patient monitoring, and also managing healthcare data effectively.
Yeah, that is really, really impressive. Now, I'm interested in knowing about the inspiration behind WellBuddy. What motivated you to develop such an AI chatbot?
I did realize, okay, it was not just me, but I'll say the entire team. We noticed that there was an increasing prevalence in mental health related issues, especially among the young people, and also access to mental health care can be very expensive. So we wanted to see if we could find a simple solution that can at least help in giving mental health support and also increasing the awareness of these issues that are affecting quite a number of people.
So if I may ask, in what way is WellBuddy transforming our healthcare system?
So we are hoping that the application can provide a leeway in improving the mental healthcare services and also enable them to be more accessible. Although the application is not meant to be a replacement for professional services, it can at least increase the awareness and the importance of mental well-being.
Now, who are the users of this chatbot? Is it both providers and patients, or just for patients?
At the moment, it's only for patients, but we're hoping that we can increase that so that at least if there are possibly any mental health professionals who would like to volunteer and maybe be able to interact with patients, I think that would be a very good thing. Yeah.
I'm sure someone watching will be saying, what is WellBuddy or how is it used? I would like you to, go through some of the features and also how it's capable of, engaging patients.
Right. So currently the application provides general advice and can also offer more information on mental health issues. The moment the version of the application focuses on depression and anxiety, but we're hoping that we can improve the features further by including more mental health resources and also providing access for professional services or assistance.
Is it possible we see the interface of the chatbot so that if somebody watching, is it possible?
At the moment, I can't show it.
All right, that's fine. All right, that's
Yeah.
fine. Now
Yeah.
let's move to our cultural heritage. Given the significance of our cultural heritage, does this chatbot include or does it consider our the cultural nuisance?
I'll say since our main focus is the Kenyan youth, we're trying to work on improving the capability of the application to our target audience and also improving the empathy of the bot and providing information in a way that is simple and effective because mental health issues are very sensitive and there's still also a lot of stigmatization. So we're hoping to at least find a way that we can improve the awareness by making the information quite simple. Yes.
Now, before we go for break, I'm happy you made mention that talking about mental health issues is very, very sensitive. Would you say that this is a strategy to, open conversations in terms of mental health? Would you say this is a strategy?
Yes, I think if people have more information about how different mental health issues affect others, they'll be able to empathize more with them. And this could also create a more open conversation, as you have mentioned. So we're hoping also the application can also go beyond the depression and anxiety issues because those are not the only problems that affect, I'll say since the application is focused on youth, it's not the only issues that affect them. So educating people can be able to dispel these myths and misconceptions and make it easier to talk about the issues. Yeah.
All right, so let's say I have a mental health issue. I log into WellBuddy. I chat with the artificial intelligence. Is it going to give me solution or recommend a drug for me? Or I don't know. How does it engage with the patient?
So far, by testing it internally, we've noticed it just encourages the user to speak more about the issue. So you try to also empathize with yourself as well, because I think that's also the first step. So it enables you to understand yourself a bit better. And then maybe it can give you general advice, but it cannot give advice on medication because that is something, unfortunately, that can only be done by professionals.
Yeah. Thank you very much. We'll go for a quick break. Please stay tuned. We'll be right back.
Looking for a job in higher education institution on the African continent? There is no need to go looking. The Africa Education Jobs Board will deliver available jobs to you via our platform. To start your search, visit our website. On our website, you will find variety of job postings classified by the sectors and professions they belong to. There are sections devoted to variety of career-related materials as well as information on African countries. All information you require based on the job description and requirements are accessible on the site. If you are looking for a job in higher education on the continent, use our dedicated portal www.africa.edujobs.com. For job market updates, you can follow us on Twitter and Instagram at AF Jobs Board.
welcome back from the break. This is HealthAfrik, brought to you by the Association of African Universities. Today we are discussing, our topic for today is revolutionizing African health care through artificial intelligence chatbot. And with us is Miss Maria Ogamba, student from Strathmore University. Hello, Miss Ogamba.
Thank you very much for having me.
Great. Now, my next question is going to be on privacy and security, since it's very crucial. So does AI, does WellBody actually consider the ethical issues of their patients? Does it try to not bring out the data of your patients? How does it consider the ethical issues?
I would say on the privacy issues, the version of the application, we do not store any user information. All the information is saved on the user's device. So in the future, we're hoping to include other measures, maybe through password protection, possibly include encryption, so that we can enhance even more privacy. And also for ethical considerations, before the application is released to the public, we would like it to go through an ethical review so that it's going to be more, I would say, it's going to be ready to be used by others. Yeah.
Yes, yes, it's very crucial because data is very important. It helps you to know whether your artificial intelligence chatbot is really impacting people, the number of people, and also data is important because it's going to help us improve on our healthcare, what we are lacking behind, right?
Yes.
Now, my next question will be on the feedback. Can you share some of the feedback or success stories with us in terms of the impact of WellBody?
At the moment, we've only been able to test it internally. We've not made it available for public use because it still has to undergo the ethical review. Because I think that's a crucial step before we release it, because the data we'll be handling is very sensitive and the topics as well. But from the little feedback we've received from the internal team is that maybe we could improve more on the empathy, because at the end of the day, it is still a bot. It may not act in the way that a human being will act. So at least if we're able to get more data that includes more empathy, it can be able to improve the accuracy of that.
Now, when you say it's used internally, is it only students from Strathmore University or people from Zambia?
From our data science team. We have not shared it to the students yet.
Oh, really? I hope you'll be ready to. I hope you'll be ready to share with others, because probably someone is interested in being able to comfortably talk about his or her mental health issue.
Yeah, I think maybe mainly on the technical issues, because the data set that we had when we were creating the chatbot was very limited. So if we are able to increase that and maybe also include things that are more in the Kenyan context, I think that would be great. Yeah.
Now, can you share with us some of the challenges you faced during the developmental stage of the WellBody, and also how you overcame them?
Okay. I'll say the first challenge we got was getting data. It's quite a huge problem that we're facing, especially in Africa, not just in the healthcare industry, but also other industries. Getting data that fits the African context is quite difficult. You find data that is maybe from Europe or from the US, and that may not fit our culture and what we are used to. Aside from that, also it was quite a new concept, and also trying to make it as empathetical as possible is quite difficult. But we found a way of improving on this. Yeah.
All right, great. Now, also, since you are planning on making this available or accessible to the majority of people, how is WellBody going to adapt to the socioeconomic conditions in Africa? When we talk about internet, for example, most of the African countries do not have internet connection. And this is something that you need to have internet, you need to have a smartphone, you need to be literate, enabled to be accessible and have access to use the chatbot. So how is this going to adapt to the socioeconomic conditions in Africa?
Okay. At the moment, the app is only available to users who have access to an Android phone, but
Okay.
we're trying to see how we can expand to include USSD access or use of SMS to reach more people, especially users who may not have a smartphone. Aside from that, maybe we can include a voice bot inside the application so that maybe if someone can be able to at least speak out what they would want the bot to respond to, it can enable them to also have that conversation.
Now let's move to collaborations. Which are the people you are planning on collaborating with, and also how can they help you? I'm sure someone watching out there will be like, oh, I'm interested in this. How can I collaborate? How can we help? So which group of people do you think can collaborate with you and make it a success?
We are open to collaborating with different types of organizations that are interested in taking this project further. This could be mental health care professionals. We're also interested in collaborating with schools because our focus is young people, and a lot of young people are currently in schools. Maybe we can also collaborate with tech experts who can be able to enable us to even improve the model that we are using. So I'll say that encompasses a summary of the people that we would be interested in collaborating with.
How
But
about the government
also
authorities? All right, move on.
the government authority. That is an interesting group. It would actually help in enabling access to areas that we may not be able to reach. So I think the government could also be useful.
You're right.
Yeah.
Now, technology keeps changing each and every day. There are more things coming up. Looking ahead, what do you envision as the future of WorldBody? What are your plans for the future?
Inclusion of Swahili can be able to reach more users because in Kenya, the most common languages that we speak are English and Swahili. And since this is our main target audience, I think to reach even more people and be able to raise more awareness. I think we have been able to find a large language model that is in Swahili. And if we're able to include that in our application, I think it will be very good. Yeah.
Do you think in the future this will be accessible to everyone in Africa, just like ChatGPT? It's accessible to everyone. Do you think WorldBody will soon be accessible to everybody in Africa, aside Zambia?
I think that would be the greatest achievement. I think that would be the best thing that could happen. Because if we can reach as many people, it could really, really help in improving the mental health care awareness. Yeah.
Now, before we wrap up, what would be your last word to someone out there who is inspired to also create something to support the African healthcare delivery system? What would be your word of inspiration to them, and also to our viewers watching?
Okay. I would say if you do have an idea or an innovation and you're able to create it, please do create it. I think there are so many talented individuals in the tech space, especially here in Africa. We have so many individuals who are really great at what they're doing. So I would encourage them to continue what they are doing, and maybe to organizations who are able to give us access to data sets in the African context so that we can also improve our models for our people. That would be very great.
All right. Thank you very much, Miss Maria Ogamba, for having us, and we hope to engage you in the next future as well. And thanks for sharing your work with us.
Thank you very much for having me, and I look forward to meeting with you further.
And that is all for this episode. Indeed, it is evident that Africa, particularly the younger innovative minds, are shaping the future of our healthcare system. Stay with us for more conversation on HealthAfrik. My name is Isabella Tata Hinakwa. Bye.